Narcan distribution on the family center, the why and the how. The primary cause of maternal mortality in New Hampshire is due to overdose. As you can see in this chart to the right, there were nearly 20 deaths related to overdose in pregnancy or postpartum period during 2017 to 2021. We know that the postpartum period is an especially stressful time for families, and half of overdose deaths are occurring within the year after giving birth and happening in people who have not been previously identified as drug users. There's also a risk for overdose in family members or friends, or even in children who accidentally take an opioid. By offering Narcan to every pregnant and postpartum person, we can save lives. The postpartum period is a uniquely stressful time and may precipitate opioid use or a relapse, especially when the isolation due to the COVID-19 pandemic is added into the mix. The Alliance for Innovation on Maternal Health, or AIM, has established maternal safety bundles to help reduce preventable maternal mortality and severe morbidity. The use of validated screening tools and offering Narcan is part of the Care for Pregnant and Postpartum People with Substance Use Disorder Patient Safety Bundle. We know that no one chooses to have a substance use disorder. Many of our friends, family, and neighbors here in New Hampshire are affected by opioid use. People can overdose on prescription or illicit opioids, and overdose deaths have been increasing over the past few years. We also know that substance use disorder is closely associated with untreated mental health conditions. So why are we offering Narcan? By providing Narcan to all pregnant and postpartum people, we can help to reduce the stigma of those with substance use disorders and increase the community saturation of Narcan. This approach may help save the lives of family members or friends, and also recognizes the potential for overdose in postpartum people without previously identified opioid use. It's difficult to predict who might need Narcan. By universally screening and offering Narcan to every patient, we avoid the risk of stigma towards people who might be using drugs. This also decreases the risk of implicit bias and increases acceptance of all birthing people. It helps to avoid the perceived risk of involving Child Protective Services if a patient does accept a kit. The screening that we're choosing to use is the Need a Quick Screen, which you can see here on the top of this picture. Underneath it is the Narcan question, and it simply states, are you or someone that you love at risk for an overdose? Would you like to take home a Narcan kit today? This is a simple yes or no question with no strings attached. This does not initiate further investigation from social work or a urine toxicology screen. And it's important to remember that they may be asking for a Narcan kit for someone else, not themselves. If a patient has a positive Need a Quick Screen, we would follow up with a more in-depth screening. So if a patient responds with anything other than never for use of prescription drugs or for non-medical reasons or illegal drugs, we would use the DAST-10 screening. If a patient responds with anything other than never to alcohol use, we would follow up using the audit screening. The DAST-10 and audit screenings are in this Family Center Substance Use Disorders and Narcan Distribution Resource Binder, which will live at the nurse's station. These screenings are to be completed on paper so that the patient responses can be reviewed by their care provider and the social worker. So what else is in this binder? Well, we have our Narcan policy, the Narcan data collection tool, a scripting for difficult conversations with patients, and patient education and resources, which include SOS recovery, Haven support services for intimate partner violence, 211 brochures, and substance use specific handouts, as well as the Narcan patient education folders which will be given to every patient who takes home Narcan. Narcan saves lives. Narcan rapidly reverses overdose from opioid drugs. The Narcan nasal spray was specifically developed to be used by family, friends, and community members who respond to an overdose. Okay, so how does Narcan work? Well, Narcan has a stronger affinity to the opioid receptors than opioids, such as heroin or oxycodone. So it knocks the opioids off the receptors for a short time, which allows the person to start breathing again and reverse the overdose. Educating our patients on how to respond to an opioid overdose and how to use Narcan is essential in helping to save the lives of members of our community. Pictured to the right, you'll see a handout that will be given in the Narcan patient education folders that the patient will go home with. How to check for signs of overdose. The person does not respond to yelling or touch. They are drowsy or nodding off, will not wake up, slow or no breathing. The skin feels cold to the touch. Pupils are pinpoint. They may be making gasping, gurgling, or loud snoring noises. Their body is limp. How to give Narcan. Move the person to their back. Hold the Narcan spray with your thumb on the bottom of the applicator and your first and middle fingers on either side of the nozzle. Insert the tip of the nozzle into either nostril. Give a dose by pressing the plunger of the applicator, and then remove the applicator from the nose. After giving Narcan, move the person to the rescue position. Then activate EMS by calling 911. All that you have to say is someone is unresponsive and not breathing. They may instruct you to give rescue breaths at this time. The rescue position is simply turning the person to their side with their legs bent and their head resting on their side. Be sure to stay with them. Breathing should resume in 2 to 3 minutes after giving Narcan, but because it is short acting, the symptoms of overdose can return and the person may need an additional dose. So we want to make sure that our patients understand the overdose response steps. Number 1, check for signs of an overdose. Number 2, give the Narcan nasal spray. Number 3, call 911 for help and stay with the person. Narcan nasal spray is packaged in cartons containing 2 doses of Narcan to allow for repeat dosing if needed. After giving Narcan, the person should be watched for return of overdose signs for at least 4 hours after the last dose of Narcan, because multiple doses of Narcan may be needed. We want to let our patients know that after giving Narcan, there could be some possible side effects, which would include rapid withdrawal symptoms, including nausea, vomiting, pain, and confusion. It's important to treat all overdoses like opioid overdoses, and giving Narcan won't hurt somebody if they are not experiencing an opioid overdose. Narcan should not be stored in the car, frozen, or kept in a place with temperatures above 80 degrees. Ideally, it should be stored in a cool place away from bright light. We should let our patients know how to get more Narcan. They can do this by reaching out to Doorways of New Hampshire, calling 211, simply asking their OB office. Both Lamprey Healthcare and Core OBGYN will have Narcan available for patients as well. In addition, many pharmacies are able to provide Narcan without a prescription, and soon Narcan will be available over the counter. Okay, great. So how does this work for us on the Family Center? So if a patient requests a Narcan kit, we'll simply get the Narcan from the Omnicell by selecting floor stock under patient name, then remove medications, and then finally select Narcan. Okay, so what to document? Narcan is viewed as a community resource and does not require individual documentation under the patient's electronic medical record, so we will not be documenting anything in Meditech. For every patient, we will document an OBIX in the triage or admit record that the NEDA quick screen was completed, whether it was negative or positive, and if Narcan was accepted or declined. This is for help in tracking how much Narcan we are giving out and that this process is being done. The next thing we're going to do is fill out the newborn nursery register or the newborn logbook, which I'll show you in a moment. And then for patients who do request Narcan, the last step we need to do is fill out the Narcan data collection tool, which is located in front of the resource binder. This is an example of the admit record. This is documented under the section that refers to alcohol, drug, or tobacco use. And then in the comments section, you'll simply write, need a quick screen, negative, Narcan requested. For documenting in the triage record, again, in the section that refers to alcohol, drug, and tobacco use, underneath in the comments, we'll write, need a quick screen, negative, requests Narcan. We'll be using the newborn logbook to track that the validated screening was completed for each patient, and then we'll simply check if Narcan was given. If a patient does want to take home a Narcan kit, we will document in the Narcan data collection tool, which is located in front of the resource binder. On this form, you'll put the patient initials, the date, that the validated screening tool was completed, that the Narcan education was reviewed, that the Narcan kit was given, that the patient got the Narcan education folder. You'll write down the Narcan lot number, expiration date, your initials, and any comments that you have. This is the Narcan patient education folder that should go home with every patient who accepts Narcan. We want to make sure that we have reviewed the signs and symptoms of overdose and how to use the Narcan nasal spray kit with the patient and with the patient's permission with their support person. We want to make sure we give time for the patient and their support person to ask questions. For more information, you can always refer to the standard operating procedure titled Dispensing Naloxone, Narcan, on the Family Center. So, in summary, quality healthcare for everyone includes the prevention of overdose deaths. On the Family Center, our goals for Narcan distribution are to respect all patients, provide education regarding substance use, overdose, and Narcan use. We want to have clear, consistent messaging. We want to collaborate with our patients and provide non-judgmental, non-punitive care. This substance use disorder safety bundle and Narcan initiative has the potential to really impact maternal mortality by saving lives, and it has the support of all of these organizations. Thank you for listening, and finally, I just wanted to provide you with some additional resources that might be helpful in developing a better understanding of how Narcan works and how we can best address our patients. Thank you so much.